Thank you for joining us on Health Diary. My name is Gladys Gashanja and we're coming to you from the Garden City residences. Now, according to the Kenya Renal Association, over 4 million Kenyans are living with kidney disease, with a significant number progressing to kidney failure. Today, we try and understand why more and more Kenyans are being diagnosed with kidney disease and more youth making it to that list. And also, transplantation has been a reality in this country. Why does it continue to be elusive to kidney patients? All those answers coming your way, but before we get to it, here now is a fact of the matter. Kidney disease is one of the most dreaded illnesses and is increasing at an alarming rate all over the world. About 1 in every 10 persons has some form of chronic kidney disease. It is estimated that 4.8 million Kenyans will be suffering from kidney disease by 2030, with the youth bearing the face of it. A number of illnesses can cause permanent damage to the kidneys, but the two main ones are diabetes and high blood pressure. Simple tests like urinalysis, monitoring of one's blood pressure, and sugar level testing can identify likely problems. Chronic kidney disease has no cure, and the only solution is dialysis or a kidney transplant to maintain life.
2015 ikianza, that is when niko na hiyo shida ya kidney. Kulikuwa 2015 January ndio nilianza kufura miguu. Nilikuwa shule kwa Ndangom. Nakumbukanga tulifika huko tukapatiwa referral, tukaambiwa twende Mbagathi. Tukatumwa picha ultrasound ya figo. Kupigwa hiyo picha nikaambiwa niko na shida ya mishipa. Sasa venye nilipatiwa dawa nikarudi home. Kurudi home ndio hiyo state ikawasen. Mimi nikafura mwili yote. Kutumwa Kenyatta mimi nilienda nikalazwa. Nikaambiwa siwezi rudi home, nikaadmitiwa. By the way nakumbukaga nilikuwa karibu kukufa. Hiyo time nilifura, nikafura. Nikashindwa hadi kupumua. Sikuwa natoka kwa kiti. Choo nilikuwa napelekwa. Kwenda hosi ikasemekana siwezi fanyiwa hiyo biopsy kwa sababu nimefura sana, nitableed sana. Sasa ikasemekana niekewe something called a catheter, inakuwaga imewekwa mpaka kwa heart. Ukienda wanatoaga hii kitu, wanatumia kuoshea nayo damu. Zinakuwa pipes mbili, moja inatoa, ingine inarudisha. Nimeenda dialysis now for 4 good years. Sina hopes sasa za kupata transplant. Ni mabeshte zangu sana wengi wamekufa juu ya hii ugonjwa. Wanashinda home. Na mimi ni msee nafaa kuwa hadi job. Nilikuwa na mwili sana, but saa hii nimekonda hivi juu hakuna food inaweza nisaidia. Food zote zenye naweza tumia lazima zichemshwe kwanza ndio nikule. Niliachaga kuurinate long time ago, like 3 years ago. Ufai kukunywa maji, not unless ukue kwa machine. That's the time unafaa tu kuconsume maji, na ni maybe 1 glass juu unatolewa na machine. Nikiweza pata kidney kama saa hii, naweza panga venye naweza rudi form 3, at least nipate grade ya maana niendelee na masomo.
The first kidney transplant in Kenya was done in 1978, and a lot more have been done after due to medical advancements. Now, the increase on the number of nephrologists and, of course, transplant centers in the country has gone a long way in giving a second chance of life to kidney patients. Now, to help us understand the kidney disease status in the country and that of transplants, with me, Dr. Khalida Soki, she is a nephrologist, and Joab Wako, who is the founder, Transplant Education Center, and also a kidney transplant patient. Thank you for your time. Let's first define kidney disease. There is acute kidney injury and there is chronic kidney disease. What is the difference?
Basically a consequence of time. So you find that acute kidney injury occurs suddenly. It happens over a matter of days to weeks. And chronic kidney disease happens over a longer period of time. It will happen over months to years. And so because of that, you'll find that there's differences in what causes them. Acute kidney injury will be caused by infections, will be caused by dehydration, for example, by diarrheal diseases, and could also be pregnancy related. Chronic kidney diseases tend to occur gradually over time, and these are diseases such as diabetes, high blood pressure, and inflammatory diseases of the kidney called glomerulonephritis.
All right, I understand acute kidney failure can actually be reversed. Explain.
And that's because of what causes it. So once the infection resolves, once the issues with the pregnancy are resolved, once the hypovolemia is resolved, then the kidney also starts to recover slowly. However, with chronic kidney disease, because of the damage that has been ongoing for a period of time, this causes scarring on the kidney, which many times is not reversible.
And does it mean for an acute disease injury, you would have to be on dialysis from then henceforth?
So we see acute kidney injury where sometimes the kidney needs some support, and you might end up on dialysis for a bit of time, so a few sessions, and then thereafter, as your kidney recovers, we go off dialysis. But acute kidney injury sometimes might not result in recovery of the renal function, and that person would end up on dialysis long term.
Okay, now Job, you were diagnosed at 27. At this point, what were the symptoms you were dealing with before the diagnosis?
I had nausea, so I would try and eat something and I couldn't keep it down, you know, so it would be, I would avoid eating solid foods, like something like meat was very hard to eat because I couldn't taste it. So your taste buds also, they don't function as they're supposed to. So food started tasting very different, and that's one of the things that threw me off, you know. I thought it was maybe food poisoning, something smaller than kidney disease or kidney failure. But it started getting a bit more serious when I couldn't sleep. So now sleep becomes, you suffer from insomnia. You know, so I couldn't sleep, I was in bed but awake, and I knew I was tired. So you get to these fatigues, you get to levels of fatigue that I never had before. You know, before you walk and you say you're tired, but that level of tired was to the point where I couldn't function.
Dr. Soke, is it possible for the symptoms to vary from patient to patient, hence giving room for misdiagnosis?
It's really difficult to misdiagnose kidney disease, to be honest. Kidney disease is a laboratory diagnosis. It is simply a calculation of percentage kidney function that uses a blood test called creatinine. So we calculate a percentage of your kidney function. Based on that, you either have kidney disease or you don't. However, I would encourage people who have a predisposition towards kidney disease, for example, diabetics, people with high blood pressure, or people with a strong genetic history of family disease, to be on high alert. Get yourself screened regularly, get the percentage kidney test done, and go to a reputable lab, go to a qualified doctor, and get your diagnosis checked out.
Could lifestyle diseases be probably fitting into the number of kidney patients we're seeing today?
We're seeing diabetes in very young people, even children, diabetes that is related to lifestyle. We are seeing hypertension at much younger ages than we did before. And because of this, we're seeing a lot more kidney injury, and yes, related to the change in our lifestyle and our diet.
From my interactions with recipients, and especially the young ones, they tend to be diabetes and hypertension. These are two things that lifestyle really affects, especially salt. Something that's very salty, not drinking water, sugary foods, these affect hypertension and diabetes. So I believe that a lot of our people like me, you know, my friends, young,
the youth,
yes, thank you, the youth,
yes.
We do not really look at what we eat. We do not. You know, this is something that is convenience. I'm going out, I'm somewhere, I'm hungry, let me grab something real quick, and then I go back to what I want to do. So our message is we should be more healthy eating, understand what you're putting in your body, because what you put in is what you build your body with.
It has been said things like tea, sodas could probably feed into kidney disease. Is this a myth or is it a fact?
We are seeing a lot of acute kidney injury, as we talked about, that results from, let me mention a few things. A lot of herbal concoctions, Many of the times we don't know what comes in these herbal concoctions, and we find people who have kidney injury because of that. I think.
Are
yes,
we referring to like chamomile tea?
those are herbs that we know. We are aware of chamomile, ginger, hibiscus. People know what that is, but many times you'll be given a green concoction, some herbal treatment, then you're not really sure what's in it. We see a lot of kidney injury that is related to the over-the-counter purchase of painkillers, drugs that are called NSAIDs, and most people don't realize that, and we see a lot of damage because of that. I cannot stress enough that the best way to prevent kidney disease is to live a healthy lifestyle, and that involves eating healthy. So a lot of fresh fruits, a lot of water intake, and avoiding the processed foods that we've talked about, the fatty foods and foods that are high in sugar, such as sodas and the like, okay? Because that decreases your risk of diabetes and high blood pressure. If you're a smoker, you have to stop smoking, and that's the beginning and the end of that. You'd find that teas are high in oxalates. So is coffee, and some nuts are also high in oxalates, and those tend to have the ability in some people to form stones within the kidney. So whenever you're taking those things, make sure you also hydrate well with lots of water, because we're not sure who will form a kidney stone and who will not.
Okay, I think that will be an ideal place to take a fast short break. When we come back, the reality of transplants in Kenya, and for the recipients, how is life after, and what you need to keep your eye on after you've been diagnosed with kidney failure, right after this break. Welcome back. Before we went to break, we were talking about kidney disease and how this is becoming a reality more and more today because of the lifestyle changes. But also, we'd like to focus on transplanting. This has become a reality more and more in the country, but there are also intricacies around it. Now, I'll start with you, Job. You got into dialysis and had a successful transplant a year later. Now, how was the experience for you finding a donor?
Ooh, it is an experience and a half. It's an emotional roller coaster. But then I think the first part of asking for a donor, how do you start that conversation? How do you go to someone and say, hey, I need a kidney or I need a liver? What do you need? But I am thankful because my family is very close. And when they had me, what I had gone through, with kidney failure and on dialysis, my sister opted to stand up and say, hey, I'm willing to donate. If I match you, I'm willing to donate. Let's just do the tests and see what the tests reveal. But then for other people, it's not so easy. I've heard of people who ask and they either people are not interested because there are a lot of myths out there about donation. And I am thankful that she was there for me, and I was able to go through the tests and we were a match. We happened to go to India for the transplant, and it's been successful. It's been 2 years.
Dr. Soki, as he says, it really is an uphill task getting a donor. Just speak on the same and some of the things that you look out for to ensure that you have a successful transplant.
I'll take this opportunity to appeal to anybody out there to be willing to become a kidney donor. Kidney donation is safe, and before we take a kidney from anybody, we thoroughly ensure that in their lifetime, they shall never need their spare kidney, because that's what your second kidney is. It's a spare kidney, okay? But we still meet challenges. There's cultural misconceptions, there's personal misconceptions, and we are seeing that we have to reject a lot of donors these days because of the lifestyle diseases that we talked about. So we will never accept a donor who has a BMI of greater than 35. If your BMI, and that's especially truncal in terms of fat. If your BMI is above 30, that also disqualifies you as a donor immediately, okay? Because of the risks that you're putting yourself at later on in your life of getting kidney disease yourself. Other barriers, of course, to transplantation and donation are the cost implications of it, and well, that's a whole other conversation.
Can dialysis be a solution for patients with chronic kidney failure?
Without dialysis, a patient who has kidney failure will die. So dialysis is life-saving, and not everybody is a candidate for transplantation, either because they are not strong enough to withstand the process of transplantation, or because they don't have a donor, or because they are unable to afford transplantation as it stands. For these people, dialysis acts as a kidney replacement therapy, and it allows them to continue living their lives.
So it's very important for patients to understand that yes, if you're on dialysis, you can get a transplant, and a transplant is the best therapy, because when you get a transplant, especially for someone young like me, you're able to pick your life again. It's a second chance. You're able to have energy. I'm able to do this because now with my transplant, I have the time, I have the energy to pursue what I want to pursue. But then someone on dialysis, maybe not. You know, they have to manage their energy more efficiently because they spend so much time on dialysis, and then the energy levels are lower than someone who has a transplant.
How much of dialysis and how much of a transplantation can NHIF relieve the costs for?
NHIF, for the NHIF members, will cater to 2 weekly dialysis sessions. Okay. However, a large chunk of the cost is still left onto the patient, because patients will still need their medication. Patients will still need the injections that they get on dialysis. Patients will still need to do their monthly labs, and that's quite an amount. So we still have some ways to go. I'm privileged to work in one of the transplantation centers that is available in Kenya, and that's Nairobi Hospital. And within our transplant package, NHIF will cover 30% to 50% of the costs of transplantation surgery, which makes it much more feasible for people to access. However, the bulk of the cost, as Joab will tell you, doesn't happen during the transplantation. It happens after. Transplantation medications need to be bought consistently. You need to see your doctor consistently, and you need to do your lab tests, your blood tests monthly, at least, you know. And these are major costs. I think coming up to about 50,000 shillings a month for many patients, and it is difficult to sustain over time. Yes.
Which brings us back to the fact that there are more youth that are stuck doing dialysis as opposed to taking on a transplantation. Explain.
Okay, so NHIF started paying for dialysis maybe 4 years ago, about in 2016, late 2016. And we're thankful for that, because a lot of people before that who couldn't afford wouldn't be able to continue doing dialysis. But then the major point is the people who persevere through dialysis tend to be younger people. You know, I don't have the exact age limit, the number, but I know that the younger people are going to persevere on dialysis for years. And I have a friend who was put on dialysis in early 2015, and because of NHIF, he's able to continue doing dialysis. When you go to a dialysis center and talk to someone young who's on dialysis for 3-4 years, they'll tell you that we can't do a transplant because I don't know how I'm going to pay for my medication 2-3 years after.
What would policymakers put in place to ensure that we have more people getting the help they need?
I think I'd like to use this opportunity to challenge NHIF to take a relook, sit down with health economists, and have a look at their numbers. Each dialysis session costs 10,000 shillings. Patients on average will dialyze twice, maybe 3 times in a week, but NHIF caters to twice. So that's 20,000 shillings in a week. On average, the cost comes to between 80,000 shillings to 100,000 shillings for the patient. These patients also many of them will stop working because of the amount of time that they spend in dialysis units. And many times they will come to the dialysis unit with a caregiver who's also taking time off work. Okay. Transplantation, the initial cost is large because it is 2 surgeries happening at the same time. But thereafter, your transplant medications comes to between 30 to 50,000 shillings a month. If the NHIF took that over, we could also get subsidized medications into the country, free these young people to return to their workplaces, free their caretakers to become active members of the working population again. And all in all, I think economically, favoring transplantation makes sense.
Now, when we talk about transplantation, you've decided you're going that way, but now the services to do the transplantation are not there. That's why we're seeing long and long lines. Why is that?
You know, I was in a meeting the other day and a person raised the issue of if we allow organ transplantation, they're going to start stealing organs. But they do not understand that there's so many loops you have to go through before you can get a transplant. You know, you have to go through counseling, you have to go through the doctors, you have to go through the surgeons. So it's not going to be easy for people to just come and take an organ, because you have to even match to know that this kidney or this liver will work with you. But then when people don't have the right information about transplantation, what they do is they'll give you that narrative that will probably scare you and make you feel like maybe I shouldn't do this. And so a lot of people hold back and wait because they're not sure what the outcome of a transplant is, even though with the right information and the right channels, you're very safe. A transplant it's a very safe procedure.
Dr. Soki, even as we finish, over 30 nephrologists now and more transplant centers, yet we have such a long list of those that need transplants. How can this be remedied?
We need to support transplant patients financially. That's the first barrier that we have. The second is we need to change perceptions because we have that socio-cultural barriers. We need to allow people, and I think it's a lot of interaction with the public that we require to improve the information uptake and let them know what transplantation is. Just to address some of the things that you have said, Joab, as a country, we adhere to the Declaration of Istanbul against organ trafficking and organ procurement. And we have very many structures in place to prevent that from happening, including ethical teams and psychosocial teams. We have 30 nephrologists, but it's 30 nephrologists for a population of up to 50 million now. So we need more, we need to train, and the opportunities are few and far between. But this is something, as the renal fraternity in Kenya, we are working on in terms of training more doctors in renal medicine and more renal nurses.
Thank you for your time, Dr. Khalida Soki, nephrologist, and Joel Bowako, who is the founder of Transplant Education Center and a kidney transplant patient himself. Well, with over 4 million Kenyans living with kidney disease, a lot more resources need to be invested in this area. We now look at the health tip.
Hot weather, it can be distressing, you're sweating, you're uncomfortable. Worse still for the babies and the elderly. What can you do to manage this weather? Stay indoors, stay in well-aerated places. If you can have air conditioner to cool you down, that's actually good. Avoid exercising in the hot environments. Keep taking lots of water, just sipping in the course of the day. Don't wait until you're thirsty. Put on light clothes, put on light shoes, open shoes, things that are actually able to breathe so you don't hold on to the heat. Then for the kids, please don't put lots of layers on them. Ensure that they are comfortable. They can actually get heat rash, they can actually get complications from if you keep them too hot for too long. And eat healthy, eat vegetables, fruits, they have quite a bit of water in them as much as you take plain water. Enjoy the season. Let's hope the rains come soon.
That has been Health Diary. Thank you for watching and for your comments and suggestions on our social media pages. My name is Gladys Gashanja and we have been coming to you from the Garden City Residences. Until next time, see you.
thank you for